Hey, I want to thank you for joining us on this edition of Polk Place. I'm Brian Lacey, and first timer in the studio with us from Health and Human Services. She is the Behavioral Health Project Manager. Her name is Sabrine Elkazaz. Welcome to the show.
Thank you for having me.
Yeah, I understand you're a bit of a new employee to the county. How long you been with us, and how'd you score the gig with Health and Human Services?
I came to the county about 9 months ago, last September. I worked previously for City of Haines City as a Wellness and Benefits Coordinator, and I have my Master's of Public Health. So I was always interested in kind of making higher impact and higher influence in the community and just being able to touch more lives in the public health arena.
Talk about how you got involved in the public health aspect of the job.
I've been working in public health since high school. So I've worked with children with autism, I've worked with children with Down syndrome. I was a teacher before, and then just continuing on my education in public health in different arenas.
I want to talk a little bit about our new program. Within Health and Human Services, we've opened up a new website, and of course you're kind of the project manager about it. Let's talk a little bit about how the need for this website came about.
So we started with listening to the community first. There was a community needs assessment done, gap analysis, there's different stakeholder engagements, and through each one of those we were seeing that behavioral health was a prominent topic. So it was one of the most top priorities, at least one of the 3 top priorities for Polk County. So it's something that we started to say that this was an issue that we needed to voice and call to action. One of the concerns we saw repeatedly was that there was no centralized location for this information for residents to find. So they were looking for many different avenues to find this behavioral health information, behavioral health resource information for them, and that becomes really frustrating. So we decided as a call to action on ourselves is to go ahead and create a website to centralize that information, making it easier for residents to find behavioral health resource information, as well as just provider information available in the area specifically to Polk County.
Within the gathering of that information, you had mentioned that there were studies done, but let's talk about at the tip of that spear. We have great leadership in this county between the elected officials and the nonprofits, and one of those nonprofits is Polk Vision. Talk about the role that they play in this website itself.
Polk Vision has been, one of the most prominent stakeholders we have. They're our biggest partners that we have here to work with the Behavioral Health Resource website. We work in many different projects, whether that's behavioral health tactical plans that we have and strategic planning, so that way we can make sure that community needs assessment is taking place and we have an action plan behind it. So they're the ones who gather a lot of the information for us, and they help us unite with different kind of agencies to make that a call to action possible. So thanks to congressional appropriation by Congressman Darren Soto, we were able to secure the funding to put that vision to make the Polk County Behavioral Health Resource website a thing for Polk County residents to use and to find providers and information for their needs.
We know from coming in on the show, Peace River Center and Tri-County, and they recognize that we are a fast-growing county, and obviously Polk Vision knows that how fast we're growing. Tell me a little bit about the features of the website.
So the website serves as a centralized location for behavioral health information in Polk County. We specialize in making sure that our providers are centralized in Polk County, meaning that they have a brick and mortar location, and they also can offer telehealth services. But we want to make sure that they offer a physical location for residents to be able to see them and have access to care. We try to reduce the barriers, and we try to reduce any issues with access to finding healthcare and health information through the Polk County website.
How do you filter providers to make sure that they can provide the services to those that need it?
We focus on credentialed providers, and we make sure that they have active licenses in the state of Florida, and as well they have a brick and mortar location in Polk County. We want to make sure that people are able to see their providers in person, and if they do choose to do a telehealth option, there is that option as well, but we want to make sure that they're servicing Polk County residents specifically.
When it comes to the brick and mortar and also telehealth, there are preferences that folks have. Talk to me a little bit about there's some that would rather do the telehealth. Talk about the importance of having both available, because sometimes people aren't comfortable, even though it's a healthcare provider, And especially with mental health, it's easier to talk on a telehealth rather than face to face.
I definitely understand, just because I've used the telehealth option when I go to my own therapist. I think that it's a lot easier and a lot, I guess, less feeling of judgment in some sort of way when you're in person, even though your therapist is there not to judge you and there to help you through any of your mental health or behavioral health issues that you're going through at the moment. But I can understand the feeling of wanting to call up a friend and feeling that same way when you're talking telehealth with your therapist. It's the ability to be able to talk to a therapist no matter where you are too. So sometimes I take a call in my car if I have to go and talk to my therapist versus going and making an appointment to go in person to a brick and mortar location. Telehealth gives the opportunity to reduce those physical barriers. So you don't have those geographical barriers of driving to a therapist's office. You're able to have a conversation at the comfort of your own home, your car, on the go.
What I want you to do is kind of state the obvious. We know we're a fast-growing county, but talk about the need for behavioral health resources within Polk County.
So it is one of the biggest priorities that we have here at Polk County. We are one of the fastest growing counties, but we also have a shortage of providers. So we're looking for providers to come into the area that are licensed in the state of Florida. We want to grow our behavioral health network just because it'll make the ability to have services a lot easier. We want to build a comprehensive directory of people who are able to provide services for Polk County. So we're seeing that there's a disparity between behavioral health services, and we're seeing that disparity between people who need these services. We're looking at trying to bridge that gap as close as soon as possible. We have recruiters right now actively looking for behavioral health providers to become part of our Polk County directory. So we're trying to grow this network of behavioral health providers as big as possible, just because we are growing and we need to service those people as well.
What I want you to do is walk me through the steps to find the site itself, and do you have to log in? Do you have to talk to me a little, or you just run through and these are what I'm interested? Walk me through those steps, if you would, please.
There's no login, honestly. There is our website is www.polkcountybehavioralhealthresources.org, or you can also use the acronyms pcbhr.org. And those are the easiest ways to go and find our website. From there, you're able to see our stats, the Florida chart stats. You're able to see different behavioral health information resources. You can see from the numbers the different kind of charting. And then you'd also be able to find the directory for providers in the area. You're able to even filter out if you have on the Polk County Health Plan. So if you're at the PHP plan, you're able to also filter out providers just for that plan that accept that too.
At the end of the day, what would you call success for the program?
Getting people the services that they need when they need it without having to look for many different options to find the same information. We want to cut out the ability to have the necessity to go and look for information in different avenues. We want to make sure that it's in one centralized location, that when you're in a crisis or if you need information, you're able to look on one website and find out all the information that's necessary. You're able to find a crisis line that's available right there to you, and you're able to reach out to Peace River or even to the suicide hotline, and that you're also in the end able to find and inform your neighbors or your friends or anybody else who may be in crisis about any behavioral health information.
We've got just about a minute left. What I want you to do is inspire those that are in need or those that may know someone in need to use the resources available to them, because that's what the site is there for.
Sure. I mean, honestly, I think behavioral health is a need, and it's a conversation that needs to be normalized. It should be the same conversation if you're saying, you know, my back has really been hurting me for the past 2 weeks. I should be able to say, I have a mental health episode for the past 2 weeks that's been really bothering me. The conversation needs to be normalized. It can save a life. And when you know that someone else is in an issue, in a crisis, you're able to help because you're more informed. Or you can even point them out to our directory in our website to get more information at the same time too.
Well, Sabrina, I really appreciate you coming in and sharing the information with us. And any time that we can help you highlight anything else that you've got going on, please come back and see us, would you?
Thank you very much. I will. Thanks so much.
Behavioral health is the term often used to describe mental health and substance use disorders. More specifically, behavioral health providers may treat emotional, social, behavioral, and biological issues relating to a person's mental well-being and ability to function in their daily life. Polk County Health and Human Services Division launched a website to start you on the path to treating behavioral health conditions. Now, if you need more information, go to www.pcbhr.org. If you enjoyed that episode of Polk Place, I invite you to like, share, and subscribe to the channel, and even check out the next one.